Hi, everyone. I want to welcome you to our informative presentation titled Secondary ACL Tear Prevention. To begin the presentation, we're going to first talk about the ACL and what it does. The ACL, or the anterior cruciate ligament, is one of the key ligaments in your knee. The job of the ACL is to keep your knee stable, especially during movements like cutting, pivoting, and sudden stops, which are all things that are common in the game of football. When the ACL gets torn, this now affects the stability of the knee. The knee could feel wobbly, unstable, and unable to support you during quick movements. Due to the ACL unable to heal on its own, most athletes that want to return to sport, they will undergo surgery. In short, with ACL reconstruction, the damaged ligament is removed and replaced with a graft. This involves your damaged tendon being replaced by a tendon from your own patella or hamstring. In the long term, this will help restore knee stability, which will allow you to return to your sport. We're now going to focus on how the ACL tears happen. An ACL injury can happen in one of two ways, either contact or non-contact. In a contact injury, the knee experiences an external force. This can entail someone hitting the back of your lower leg, a direct blow to the knee, or being involved in a collision or tackle. As for non-contact ACL injuries, they are more common and often linked to poor movement patterns or muscle imbalances. These injuries typically occur when the knee is placed in a vulnerable position during dynamic activities such as jumping and landing, cutting, pivoting, twisting, or the knee being hyperextended. The primary contributors to non-contact ACL injuries are often muscle weaknesses, poor biomechanics, or a combination of both. These factors can increase the risk of the knee moving into a valgus position, which means the knee caves inwards. As we can see from the picture, the knee is bending in towards the midline of the body. You also might know it as knock knees. This position is particularly dangerous because it places more strain on the ACL. Now, shifting focus to the population most affected by ACL injuries. At the top of our list is history of knee injury. Since you've experienced this before, your risk of another injury is already elevated. However, there are additional risk factors to consider. Females are 2 to 10 times more likely than males to get injured. If an athlete participates in a jumping, cutting, or contact sport, they are at a higher risk for an ACL injury. Age will range from about 15 to 30 years old. And lastly, those who are not involved with prevention programs. We're now going to move on to the aspects that put you at a higher risk for a second ACL tear. To clarify, the last slide was addressing the risk factors for first-time ACL tears. We are now talking about someone who has already previously experienced an ACL injury, and all these factors put an athlete at a higher risk for another ACL injury. Our first risk factor is having a previous ACL tear. Our second factor is muscle weakness, specifically having asymmetrical strength between both quads. Our third factor is looking at biomechanics in an athlete having poor, inefficient, or suboptimal movement patterns. Our fourth risk factor is mental preparedness. It will be touched later on in the presentation, but it is really important for our athletes to not be overconfident or overly fearful in their movements and return to sport. Lastly, it puts you at a higher risk for a second ACL tear if you return to sport too early within your rehab. Here on this slide, you will see 4 main points that will be discussed for the rest of the presentation on how to avoid re-tears. Our first point is that we want our athletes to be patient with their rehab. Being able to return to sport after 9 months is ideal for a healthy and safe recovery. Next, we want to focus on training the quad. Having symmetrical quad strength between both legs is very important. Third, we will focus on movement quality. We want quality over quantity. As I discussed before, we do not want those suboptimal movement patterns. Lastly, psychological preparedness. It is extremely important for athletes to be in the middle of the spectrum of overly confident and overly fearful before they return to their sport.
All right, so this is what your recovery timeline tentatively will look like while you are trying to recover from surgery and return to sport. This is what a progression after ACL surgery might look like. Physical therapy is focused on decreasing swelling, restoring knee range of motion, and improving strength. Around 12 weeks is when you might be able to start to return to a higher level activity, such as running. By 3 to 6 months, you're going to be able to start to do multi-directional and sport-specific drills. By 6 to 9 months, you're going to be able to return to graded practice. This will look different for everyone. By the 9+ mark, you should tentatively be able to return to your sport. Returning earlier than this is not recommended as it increases your risk of getting a second tear. The right criteria to return to sport is important, which is why the individual experiences are variable because you need to reach certain standards to be able to return to sport. So like it says on the bottom of the slide, individual experiences may differ depending on what you look like after surgery and what your specific injury type was. So we're going to spend the next couple slides discussing quad strength. While it's important to strengthen the whole body, strengthening the quad is super important because the quad plays a huge role in preventing your risk of getting a second tear. 90% quad strength symmetry is the goal. Achieving at least 90%, which is the standard, or better in strength of your opposite limb really reduces your risk of injury rate by 84%, according to this study. There's an entire test battery determined by your PT, if you can return to sport or not, that includes hamstring strength and hop test symmetry. People tend to have an easier time restoring hamstring strength and hop test symmetry, so for this presentation, we're not going to focus on those as much and just talk about quad strength. Being aware of what your quad is able to do strength-wise is going to really reduce your risk of a second tear. The standard to reduce injury is unknown, the exact standard at least. But there's a good target below. Why do we follow this? Your quads are a major muscle group that holds your body up against gravity during sport. So using a body weight, as listed below in the Newton meters per kilogram, as a reference for this strength might be more informative than not using it, especially if your quad strength before the injury was on the lower side. We don't know what the threshold is to protect against injury, but the literature shows uninjured athletes are able to produce about 2.3 Newton meters per kilogram of quad torque. Torque is the amount of rotational or twisting force that you are able to produce after applying a pound of force about a distance of a foot away from your pivot point. So for example, if you take a wrench, the wrench manufacturing companies create the handle of the wrench to be a certain distance from the point of rotation where you're going to screw off the bolt. And this gives you a better advantage to have more torque when screwing the bolt off. Talking a little bit more about quad strength, there are sex differences in quad strength post-ACL reconstruction. Females have, as listed in the pink box, a decreased rate of torque development and strength gain after ACL reconstruction. So what does this mean? Torque is how quickly you can generate force. This is going to be really relevant to running, jumping, and landing. So when you're running, jumping, and landing in your sport, you really want your muscle to be working and being able to produce force quickly and as quickly as you can, producing strength in your quad as quickly as you can is really going to be important. Unfortunately, females have a decreased rate of torque development. We really need to focus on this and be aware of this when doing physical therapy and returning to sport. Females also have decreased brain excitability. Decreased brain excitability is a central mechanism that contributes to quad weakness after ACL surgery, and atrophy, going on to the third point, is a potential mechanism that contributes to quad weakness after ACL surgery. Females are worse off than males in both of these, unfortunately. So it is really important for female athletes post-ACL surgery to continue to strengthen their quads to reach that 90% symmetry and minimize the risk of a second tear. Like it says on the bottom of the slide, thus why female quad strength is so important. Since I only touched on it briefly, if you have interest in learning more about how females have decreased brain excitability after ACL reconstruction, you can go to the Women's Football Hub and listen to podcast episode 3, where Dr. Anne Leung will speak a little bit more about this. Different exercises that you can do to focus on strengthening your quad. You can do what's called either open chain or closed chain exercises. So in open chain, you're just isolating the quad, as you see on the gentleman on the left. In A, he's doing the leg extension machine, which you might have used before. This really decreases the amount of chances that you have to compensate and use other muscles instead of just your quad. So this is great in the earlier stages of recovery for increasing quad strength. In B, on the right, the gentleman is doing what's called a closed chain exercise. This is a really functional exercise because it's pertinent to doing functionality in your training. So when you're running down the field, your foot is in contact with the ground. And similarly, in this exercise, your foot is in contact with the exercise plate on the leg press machine, which you might have used. So this is what we call functional strengthening because it's going to relate to you running down the field during soccer. We're going to look a little more at quad strength. We're going to talk about eccentric and concentric strengthening. So here we have what's called eccentric strengthening. This is when the muscle is in the lengthened position. So as you see, I'm going down really slowly. I'm lengthening my muscle, and I'm doing what's called eccentric strengthening. On the right, you have concentric strengthening. So I am pushing up from my squat quickly, and my quad is going into a shortened position. So this is considered concentric strengthening. On the left here for eccentric, we consider this the lowering phase, which a nice simple way to think about it. And on the right, we have concentric, the up phase. To end this slide, I would just like to talk about how eccentric exercise is really helpful in regaining quad strength and may address some of the neurological contributors to quad weakness. This is an example of how you might incorporate eccentrics into your exercise routine.
Okay, so as Lindsey mentioned, quad strength is really important. However, when we squat, we're using our entire leg. So how can we change the restrictions in the squat in order to bias our quad and make that the focus of this movement? And why is the quad important? So we know as females, you're going to have more atrophy. We're going to have decreased peak force and decreased strength after ACLR than males. So this is going to be really in focus, really a big focus for us in order how we can get the most force out of our quad. And so looking at this picture here, you have the orange and you have the blue line. So looking at this first blue line here, we see that the line from the knee to the center of mass, which is that vertical red line, is smaller. When you look at this blue line is much larger. And so the comparison between those two is showing us how much force we need from the quad. So the larger line is indicating a larger force because this is a larger distance that our knee is from our center of mass. So the farther our knee is from our center of mass, the more force our quad is going to need to put out in order to have us do this squat. And so a good analogy is if you hold a milk jug close to your chest, that's like this left picture here, it doesn't feel as heavy. When you hold that milk jug way far out from your body, it feels a lot heavier, which is requiring a lot more work from your muscles. And more work equals bigger strength gains in the long run. And so this picture here on the left is the better type of squat that we want to do to induce a bigger quad gain. And so when you're doing a squat, you want to think about letting your knees go over those toes or elevating those heels to allow those knees to go forward in order to get more bang for your buck in terms of quad strength when you are squatting. Also, our bodies are pretty smart. So this picture here is a common movement pattern that we see with people after ACLR. So in this picture, we're going to pretend that I had an ACL repair on my right leg. And so you can see that I'm really shifting my weight over to my left. And this is what we call a between limb difference. So between limbs, my right limb is doing less work than my left limb because I'm shifting all that weight over onto the right. And this is also something we want to look out for because if our whole goal as a physical therapist or as an athlete is to get our quad strong and we're shifting away from that leg, this isn't giving us that stimulus or strength gains that we need because we're constantly going to be loading that other leg. So what are some examples that we can use in order to make our quad strong? So again, a normal squat, making sure those knees are going over those toes, like I mentioned before in this picture, elevating those heels. Lindsey can get her knees a lot farther with that chest nice and upright to have a big blue lever arm or a bigger force required from that quad. And then again, like I explained before, that shift away from that right leg that I was showing you, our bodies are smart. We're scared to load that leg we haven't loaded in a long time. So forcing an athlete or forcing yourself to do strength when available or cleared on that impaired side is really what's going to increase the strength gains of your quad. So all of these are examples of how we can do that. Then we also have movement quality. And so movement quality is going to really be determined by where we're strong, but it's also going to determine how much we stress our ACL. And so we want to integrate this strength that we gain in slow movement patterns into faster optimal movement patterns to decrease force on those passive structures. So your ACL is a ligament, and when we don't have strong muscles, we're going to rely on those ligaments to take all of that load. And these two videos are going to be drop down. So I'm jumping off of a box, and I want to look at the difference in movement patterns and which one we think is more optimal. So this first one, as I land, my knees, you can see, don't bend a ton. So we're going to watch that again. Look at those knees. They really don't bend a lot. So this is called a stiff leg landing. And when you land with that stiff leg, you're going to have a big force going right through your body. It's called vertical ground reaction force. And this is increasing strain on that ACL. Now, the second video here, you can see my knees bend a lot more. So I'm going to play that one more time. You can see those knees really bend, and that is going to increase our muscles to be working. And that's going to decrease our stress on the ACL. It's going to decrease that vertical ground reaction force going through our body. And so research shows that we want to use external cues. So this pink box here to your right, external cues are going to like really make that stick, really make us find those quality movement patterns much better in sport and in training. And so using cues such as land softly, sink into the ground, land on a pillow, just thinking about that as you're moving is really what's going to help you adopt these more optimal movement patterns to decrease the stress on the ACL. Whoop, there she is again. Nice knee bend there. So again, we said optimal movement. It's not just that up and down knee pattern. We also want to look at the frontal plane motion or the caving in of those knees. And as Kayla mentioned before, with non-contact ACL tears, they can happen when those knees come in from midline. And so these poor biomechanics can actually increase your predictor or risk of ACL tear. And so practicing these movements with more quality, so practicing our squats and our landings, more so landings in a knees over toes movement pattern versus letting our knees come in towards one another is going to decrease our risk for secondary ACL tears. And so looking at that symmetry, making sure both legs are kind of knees are stacked over our toes, driving our knees out. You can use those resistance bands there. And that is a really good thing to emphasize when you're looking at movement quality. We've seen this timeline before. Lindsey ran through it at first, and we went through all of that. We went through strength, we went through movement quality. Now we're here, we're at the point where we want to return to sport. So how are we going to do that, and what comes next? So returning to sport, this is a cool little diagram that really outlines all the necessary needs before we can return back to sport. And this is right where you guys are, right where you really need to start being more sport specific. And so you guys all play soccer, and there is a physical conditioning component of that. So it's like if you've ever returned to preseason without training all summer, your body is screaming at you, telling you it's really not ready. And so us as physical therapists are here. Yeah, you might not be able to go run or play your sport for hours at a time yet, but we're here to give you those steps to lead you up to that. And so bike intervals, any other types of equipment, rowers, ellipticals, we can get your cardiovascular system ready to handle what is necessary before you can get back to that sport and return to running. And so we understand that you can, as a soccer athlete, you might run 8 miles. You're not jogging 8 miles. You're running those 8 miles in 4 to 6 second spurts. And so our job is to simulate that using other types of equipment, because we know you can't be running and doing that type of high intensity or high volume training just yet. Then when we look at sport-specific drills, we're looking to integrate those movement qualities and work on changing direction and work on different types of drills to incorporate progressing the speed and different planes of motions and adding reaction times, which I'll go over in the next slide. And lastly, what goes into returning to sport is our training load. So think of your capacity or the ability that you can, the amount of things you can tolerate as this cup. And as you fill up that cup, that's your loads. We're doing PT, we're doing some type of physical conditioning, that cup's filling up, but we want to keep you right below that level. And this isn't just the job of us physical therapists. We have your coach, we have your whole team, and it's 100% going to include all of these things. So it's a big bubble that a bunch of people are involved in to get you back to sport. So let's go back to the picture, that timeline. We finished all that stuff. You're at that 12-week mark and you're ready to start running and returning to more plyometric type drills. The orange box is the first thing that you want to consider. So you must have over 80% of your injured side the strength of your strong side. So if I injured my right side, I need to have 80% of the strength of my left on my right. And so that's a big key before you can even start running in a straight line. You need to also be able to run 12 minutes and have no laxity, full range of motion, and good quality movements like we talked about. When you move to multi-directional, so anywhere where there's a pink line, you must have 2 out of 10, no swelling, satisfactory progress, less specific. But then once you go from multi-directional to specific drills or specific skills, that is going to incorporate even more strength. So now we need to have, on my right side, I need to have 90% of the strength that I have in my left side, if my right is the injured side. And so this specific skills are going to increase our speed, increase our intensity, add a cognitive component, which I'm also going to talk about next. And that's going to make it a lot harder. So our muscles have to be stronger in order to tolerate that. This progression is a linear progression, but you must meet these guidelines here to the right. Like I said before, there is a psychological component to it. And this little depiction here is looking at confidence. So this confidence scale, you have 2 sides. And so each extreme is going to have an increased risk for ACL tears. And we can be on the right side, which says overconfidence. So if you are overconfident in your skills, you might return a little bit too fast, which is increasing our risk. On the contrary, the left side is over fearful, which if you're over fearful, you might have hesitations that might also increase your risk. And so the ideal range for a return to sport athlete or someone who's really ready to go back is to be right in that middle, in that of the confidence scale. And so there, as physical therapists, we can give outcome measures, self-report scores, surveys that can gauge your confidence. But literature shows that women are more likely to be on this left side or overly fearful. And so us as physical therapists are there to help you assess and build that confidence, looking at your movement patterns, being objective about what you're doing, what your training is, so that you can feel confident when you do return to sport. So besides the confidence scale, we also need to think about the changes in the brain that happen after ACLR. So when you're rehabbing, you're constantly thinking about what's going on at my knee. I need to bend my knee. I need to straighten my knee. When in reality, you don't really think about things like that. Like when you're running down the field, you're not thinking, am I bending my knee? Am I landing this way? How am I moving my body? Because it's more natural. And why is it so important for it to be natural? Because that's how we move in real life. And so I like to think of it like as our brain and our muscle connection is like a GPS. When you set your GPS, you are just following the directions of the GPS. Whereas after an ACLR, we are more reliant on our visual cues. So we have to look for road signs. We have to think about what's going on. We have to think about turning, putting on our blinker, doing all these excess things. And so we want to try to decrease the reliance on our vision and cognition after ACLR and get back to that more natural scenario where our GPS is on and we can be more reactive and more stable in situations such as playing our sport. And so training is a way that we can actually help this and practice those movements that are going to challenge our brain to simulate the combination of a cognitive and a motor task. So thinking and acting at the same time. So the first thing we have is dual task. So here I'm jumping over cones and counting down numbers. Dual tasking, what it's going to do, it's going to simulate those game decisions of I'm running and I'm looking at who to pass to, communicating with my teammates. Then we have graded exposure. So graded exposure, we want to increase the difficulty of movements. At first we're standing, then we're hopping, and hopping is adding an extra component. After hopping, we hop side to side. And so this is just increasing difficulty as you go. Perturbations, we're allowing our brain to correct error. So when someone bumps us in a game, we need to be able to stabilize and make changes while we're in the moment. And then motor imagery. So this allows our brain to simulate tasks in your imagination, and especially because females are more likely to be on that lower confidence and more fearful end of the spectrum, this is a way we can encompass and increase that confidence in how do I move? Let me imagine moving the correct way, scoring that goal, running at full top speed, and really increase the benefit and get back to sport as fast as possible. So after going over the biomechanics, the quad strength, patience, biomechanics, and psychology, we want to review those risk factors that are non-modifiable. So we know history of knee injury, females, jumping, cutting, contact sports, and age 15 to 30 is going to give us a higher risk of ACL tear. We also have modifiable risk factors though. Quad strength, poor movement patterns, poor psychological preparedness, and those not involved with prevention programs. So the good thing here is that we can do a lot to prevent a second injury. All 4 of these bullet points are things that we talked about, things that you can implement, and things that you will continue doing after you're done PT, after you're done your sport, and throughout the rest of your life. So this nice summary slide, if you remember nothing from our PowerPoint, it should be this. So how do we avoid re-tears? Being patient is going to be your friend. Waiting at least 9 months, no less than 9 months to return to sport in order, as well as reaching those metrics. So training your quads is going to be a really big metric. So remember that 80% to run linearly, 90% to start doing sport-specific skills. And so that, again, is 90% of our right leg. If that's our injured side, it must be 90% as strong as the other side. This 2.3 metric is what Lindsey talked about, which is really important too. So it's not a standard by any means, but it's a good metric to go off of, because if prior to going into your ACL tear, you had less than 2.3 on your unimpaired side. So if my left side only had 2 Newton meters per kilogram of strength, and I'm trying to get this 90%, that's getting me less than the metric that I want to. So yes, we have that 2.3 and that 90%, but looking at it more holistically of, hey, we want this baseline of strength, but we also want limb symmetry. So really trying to match those two together. And then looking at those movement qualities. So looking at how we're squatting, how can we bias the quad in our squat, and how can we move in a way that's not going to offload it when we're trying to rehab it, but also move in a way that's symmetrical once we have that strength and we are confident in that leg, and making sure that those between limb, so shifting away, or within limb, trying to use our glutes, differences are not decreasing our strength gains there. And lastly, psychological preparedness. So making sure that we are confident, we're in the middle of that confidence scale, not fearful, not overly confident. And then we are training those cognitive dual task mechanisms in order to be as prepared as possible for anything coming our way. So, thank you so much for listening to our presentation. Special thank you to Dr. Anne Leung. She really helped us out making this presentation, and thank you guys for listening. And we appreciate all of your attention. If you have any questions, please reach out to Anne or any of us. We would love to attend to your questions.